Here's a detailed drug monograph on Doripenem covering all requested aspects comprehensively for clinical or academic use. Doripenem, detailed drug monograph. Number 1. Basic drug information. Generic name, Doripenem. Brand name, Doribax. Drug class, carbapenem antibiotic, beta-lactam subclass. Formulations available. Doripenem for injection, powder for reconstitution, intended for intravenous infusion only. Supplied in 500 milligrams vials. Definition. Doripenem is a synthetic, parenteral, broad-spectrum carbapenem antibiotic that is structurally related to imipenem and meropenem. It is used for treating complicated and resistant bacterial infections in hospitalized patients. It is effective against a broad range of gram-positive, gram-negative, and anaerobic bacteria. Hanner 3. Mechanism of action. Doripenem works by inhibiting bacterial cell wall synthesis. It binds to penicillin-binding proteins, PBPs, inside the bacterial cell wall, thereby disrupting the final transpeptidation step of peptidoglycan synthesis. This leads to cell lysis and bacterial death, making it bactericidal. High stability against many beta-lactamases. Effective against Pseudomonas aeruginosa and extended-spectrum beta-lactamase, ESBL-producing bacteria.
Hanner 4.
Uses. Doripenem is generally reserved for severe or hospital-acquired infections caused by multidrug-resistant bacteria, complicated intra-abdominal infections, e.g. peritonitis, abscess, complicated urinary tract infections, e.g. pyelonephritis, off-label for hospital-acquired pneumonia and ventilator-associated pneumonia, not FDA-approved due to safety concerns. Nanosure 5 indications. FDA-approved indications. Complicated intra-abdominal infections, CIAI, complicated urinary tract infections, CUTI, including pyelonephritis, not approved due to increased mortality risk, hospital-acquired pneumonia, ventilator-associated pneumonia, VAP. Number 6. Contraindications. Doripenem should not be used in patients with known hypersensitivity to doripenem, carbapenems, penicillins, cephalosporins, or other beta-lactam antibiotics. Previous anaphylactic reactions to any beta-lactam antibiotic. Caution in epileptic patients due to seizure risk. 7. Precautions before taking. Inform the doctor if you have kidney impairment, dose adjustment required, history of seizures, epilepsy, or other CNS disorders, liver disease or abnormal liver enzymes, allergies to other antibiotics like penicillin, cephalosporins, or carbapenems, pregnancy or breastfeeding, use only if benefits outweigh risks, Category B. Recent diarrhea or gastrointestinal infection, risk of C. difficile. Note, use with caution in elderly and critically ill patients. How to use. Route. Intravenous infusion. Reconstitution. Reconstitute each 500 milligrams vial with 10 milliliter sterile water for injection. Further dilute in 100 milliliters of normal saline or 5% dextrose before administration. Infusion time, over 1 hour. Administer every 8 hours as directed by the physician. 9. Dosing information. Adult dosage. A. Complicated intra-abdominal infections, 500 milligrams IV every 8 hours for 5 to 14 days. B. Complicated urinary tract infections, 500 milligrams IV every 8 hours for 10 days, may extend up to 14 days. Renal dose adjustments, creatinine clearance CRCL, dose, frequency, DOL 50 milliliters per min, 500 milligrams Q8H, 30 to 49 milliliters, 50 milligram Q8, 30 milliliters min, not on dialysis, 250 milligrams, chemodialysis, avoid or use with caution. Pediatric use, not established, not recommended. Number 10, missed dose and overdose. Missed dose, unlikely in hospital settings. If missed, administer as soon as remembered, unless close to the next dose. Overdose, symptoms, seizures, neurologic toxicity, confusion or altered mental status, management. Discontinue the drug, supportive care. Hemodialysis may help remove the drug from circulation. Number 11. Stop or avoid taking. If signs of allergic reaction, hives, difficulty breathing, swelling of face, lips, tongue, throat, development of seizures, severe diarrhea or colitis could be Clostridium difficile infection, any signs of liver dysfunction, yellowing of skin or eyes. Side effects in detail. Common side effects, nausea, vomiting, headache, diarrhea, rash or injection site reactions, e.g. phlebitis, fever. Serious side effects, seizures or convulsions, severe allergic reactions, anaphylaxis, Clostridium difficile associated diarrhea, elevated liver enzymes, ALT/AST, thrombocytopenia, leukopenia, interstitial nephritis, Stevens-Johnson syndrome, rare. 13. Vital information. Monitor renal function before and during therapy. Monitor for signs of neurotoxicity, especially in renal impairment. Discontinue if severe diarrhea or rash occurs. Use only when needed to reduce the risk of antibiotic resistance. Use of probiotics may help prevent antibiotic-associated diarrhea. Number 14, drug interactions. Major interactions. Interacting drug effect, valproic acid. Doripenem significantly lowers valproic acid levels, increasing seizure risk. Probenecid inhibits renal excretion, increases doripenem levels. Other carbapenems or beta-lactams, additive neurotoxicity risk. Nephrotoxic agents, e.g. aminoglycosides, vancomycin, increased risk of kidney damage. Minor interactions may alter lab test results, e.g. Coombs test, liver enzymes. Thank you. Have a nice day.